Okay. I know we have lots to talk about, so maybe we could go ahead and
Sure.
get started and let people continue to flow in. Welcome, everybody. Thank you so much for joining today. My name is Anya Lewin, and I'm a staff member of the Department of Global Health Community and also one of the staff co-chairs of the department's DEI committee. I'm going to be moderating this event, which is Structural Racism in Washington State's Tax Code, Strategies for Action and Improving Health. Before we start, I also wanted to extend some gratitude to the Department of Global Health, the Center for Anti-Racism and Community Health, and the DGH DEI Committee for sponsoring this event, as well as to Washington Physicians for Social Responsibility for collaborating on this event to make it a reality for us. Also, a very special thanks to James Pfeiffer, the DGH DEI Director, for organizing, Chris Joss, our IT specialist, and Letty Munoz, the Department of Global Health Communications Manager, for all the hard work that went towards bringing us together on this webinar. I'm going to go ahead and share a quick slide for our land acknowledgement. We honor the histories, resistances, and presence of the Coast Salish peoples, both acknowledged and unacknowledged by the U.S. federal government. In order to push back against and not accept the nature of our occupation, please consider paying real rent to the Duwamish, whose land we occupy. May our work and event today do honor to our position as guests and occupiers on this land and acknowledge our responsibility to do something about it. So we are here today because the deepening racial wealth gap is a major social and political determinant of health. And advocates tell us that unjust tax codes, often targeting communities of color around the country, are partly to blame, and that Washington State is no exception. A number of local community advocacy groups are working hard to expose these injustices and organize for change. And as public health professionals, we know that systemic and structural racism impacts public health globally and locally through complex pathways, although it is often less appreciated or understood in our work. We also recognize that taxation is a fraught and controversial political issue, and that many attending may have different views and perspectives on tax issues. We just want to be clear that everybody is welcome here in this space, and the goal today is really to provide an educational opportunity to learn more about how different approaches to taxation may impact public health and to stimulate constructive discussion on the issues. So thank you all for being here. So now I have the honor of introducing our panelists. And then once I complete those introductions, I'll hand it back over to them, who we all are here to hear from. So first, Tracy Young is a senior policy analyst at the Washington State Budget and Policy Center, where she advocates for direct cash and other policies that improve economic well-being. She has also worked at the Chinese Information and Service Center as a case manager, serving immigrant family caregivers and in-home care recipients. Tracy has a Master of Public Health through the Community-Oriented Public Health Practice program at the University of Washington. Thank you for being here, Tracy. Next, we have Dr. Anjum Hajat, who is an associate professor in the Department of Epidemiology at the University of Washington. Her research seeks to understand how social and environmental determinants of health contribute to poor health and health disparities. We also have Chelsea McElroy, who is the statewide coordinator for Washington for Black Lives, a coalition of organizations founded in 2020 to amplify the policy needs of Black Washingtonians. Chelsea has been a career early learning professional and family advocate. Using her voice to elevate her community led her to run for and be elected to the Tacoma Public School Board in 2021. She continues to serve her local and state communities through the many hats she's worn. Samuel Martin is the CEO and founder of SDM Consulting, a small public affairs consulting firm that supports state-based and federal policy change. Sam and SDMC believe systems need radical change for them to serve communities that need support the most. He has served as a lobbyist for organizations like Washington for Black Lives, the Mockingbird Society, and others. And last but certainly not least, we have Lily Dearwater, who is the Economic Inequity and Health Program Manager for Washington Physicians for Social Responsibility, an organization of health professional advocates working to address upstream threats to health. She is a graduate of the University of Washington's Community-Oriented Public Health of Practice program. So I will go ahead and hand it over to the panelists now. And first off, Tracy. And I think if each of you could please share a bit about your organization as well in your introductions, that would be really helpful. So thank you, Tracy.
Sure. All right. Thank you, Anya. I guess I'll share my screen first just to make sure that is working. Okay. Can you see my slides okay?
Yeah.
Okay. Well, thank you. Good evening, and thank you so much for having me. My name is Tracy Young. I use she, her pronouns. And I work at the Washington State Budget and Policy Center. We are a research and advocacy organization that our mission is really to improve the economic well-being of all people in Washington State. So we do that through research and analysis, but we also do a lot of advocacy with state partners, other advocates across the state to talk to legislators and push for policy change. And I get to start us off today by kind of laying the ground on our state tax code and specifically how our state tax code is racist. So I'm gonna start with a few charts that might be a bit disheartening, and then I'll shift to some policy changes that are really feasible that we can enact to improve our tax code. So before I get into that, I wanted to kind of share some principles that we believe every state tax code should have. So at a very basic level, our state tax code should ensure everyone is contributing based on their ability to pay. It should also adequately fund and maintain shared community investments such as schools, parks, and health services, and it should also advance racial justice. So these are things that we believe. It's not the reality, unfortunately, right now, but this is what we are working toward. So just diving into our state taxes, this is a pie chart that shows where our state taxes are coming from, or where our state revenue is coming from. And you can see it mostly comes from retail sales and use tax, business and occupation tax, and property tax. Over half of our retail sales and over half of the state revenue comes from retail sales and use tax. So this is the tax that you'll pay when you go to buy, go to the store, buy things like shoes and clothes, if you need a new laptop, or when you go to a restaurant. And then all other taxes combined include insurance premiums, liquor, cigarette, cannabis tax, things like public utility tax. But you can see that the retail sales and use tax, business occupation tax make up almost 3/4 of our state tax revenue. And one thing that is glaringly missing from our state tax revenue is an income tax. And so the sales tax is a very regressive tax because it's the same flat rate for everyone, regardless of income. And so if I am making, say, $50,000 a year, and someone else is making $200,000 a year, and we go into the store and we both need to buy a new pair of shoes, and we buy $100 worth of shoes. We're paying the same tax rate, right? Around 10% sales tax. We're both paying about $10 extra in taxes. This has a much bigger impact on me, right, with a $50,000 income versus someone who is making $200,000. And so what a regressive tax means is that it takes a larger chunk out of people with lower incomes than it does people with higher incomes. And so because our state relies so much on this very regressive tax, it makes our entire state tax code very regressive. And you can see here that households in Washington with lower incomes are paying more in taxes as a share of their income. On the left-hand side, you can see that households that are in the lowest 20% of the income bracket. So these are households that are making less than $33,500 are paying almost 14% of their income in taxes. On the other hand, the top 1% of income earners or households that are making over $878,400 are paying only about 4% of their income in taxes. So in other words, the lowest 20% of income earners are paying over 3 times more in taxes as a share of their income than the richest 1%. And this chart that you see here almost perfectly shows a regressive tax code. As you can see, it's kind of step by step as people are making more, right? They're moving up the income bracket, their tax rate, their effective tax rate actually decreases. And unfortunately, Washington is infamous for having a very regressive tax code. For a very long time, we had the most regressive tax code in the nation. Very recently, a report came out in the beginning of this year that showed that we actually moved up thanks to some progressive changes to our tax code, like the capital gains excise tax and the working families tax credit. So we did see an improvement, but now we are the second most regressive tax code in the country after Florida. So there is definitely room. We can see progress in our state, but there's a lot more room for improvement. And when we break down this data, we can also see racial inequities in who pays taxes. This should not be surprising to us because of centuries of racist policies. Black, Indigenous, and people of color have been stripped of opportunities for economic security, resulting in BIPOC households being overrepresented in the lowest income levels. So what we see here are difference in state and local effective tax rates from the statewide average broken down by race and ethnicity. So the line down the middle, this right here, is the statewide average. So in 2021, that was 7.7%. So across the board, households were paying about 7.7% of their income in taxes. But when we look at the data broken down by race, we can see that white and Asian households were paying below the statewide average, so about 7.6%, and Hispanic and American Indian, Alaska Native households were paying the highest percent of their income in taxes, about 8.4%, followed by Black and Hawaiian Pacific Islander households. And in effect, what this means is that our tax code leaves many communities of color with less financial resources compared to white and Asian households. And I do want to make a caveat here that the Asian category encompasses many different ethnic groups. And so there's a lot of variation in terms of income levels within this category that is obscured when this data is aggregated. And so we talked about the disparities in the tax code and who pays the most in taxes. And of course, that has impacts for opportunities for wealth accumulation among households of different races. So you can see here, this is data from 2019, the median net worth of different households broken down by race compared to a typical white household. So in 2019, the median net worth of a white household was over $286,000, but it was only about $13,000 for a Black household, and about $29,000 for a Latino household. So you can see that for a typical Black household, the median net worth was only about 5% that of a white household, and a Latino household had median net worth of only 10% of a typical white household. All right, so I did promise that we would talk about some more positive things, ways that we can make our tax code less racist. So I'm going to cover 5 different policies at a really high level. And if you have any questions, I'm happy to talk more about it later. So I'll cover the Washington Future Fund, Guaranteed Basic Income, Working Families Tax Credit Expansion, Real Estate Transfer Tax, and Wealth Tax. The Washington Future Fund is the name of our state's baby bonds program. It is just a proposal right now. It has not been enacted. But a baby bonds program essentially is where the government invests a certain amount of money for every eligible baby, and that money will be invested and managed by the government until the child becomes an adult, and it can then be withdrawn for wealth building activities. So in Washington State, we have this proposal called the Washington Future Fund, where our state would invest $4,000 for every newborn enrolled in Apple Health before their first birthday. And that money would be invested and managed by our state investment board. This is the body that manages like state pensions. And then that money can be withdrawn between the ages of 18 to 35 for wealth building activities, including attending post-secondary education, home ownership, and entrepreneurship, or starting a small business. Another policy proposal is guaranteed basic income. So this is an idea or a program that provides regular, unconditional, and unrestricted cash payments to participants. And GBI, or Guaranteed Basic Income, differs from Universal Basic Income, or UBI, because it is targeted to households experiencing the greatest barriers to economic security. And we believe that this targeted approach really helps us to achieve greater equity versus a universal approach. There have been lots of successful pilots across the country. There are about 150 pilots that have happened or are happening right now. And we have several right here in Washington State. Just two that I will name are GRIT, Growing Resilience in Tacoma. They had a 1-year pilot that was very successful, and they're now in their second cohort. They recently received funding from the state to continue the program. And the other program I want to highlight is called The Nest. It's run by an organization called Hummingbird Indigenous Family Services, and they focus on Indigenous pregnant people, and they provide $1,255 per month to pregnant people from pregnancy until the baby's 3rd birthday. And so we'll be able to see the results in a couple years. The next policy that I want to talk about is the Working Families Tax Credit expansion. So the Working Families Tax Credit actually is a program that has been implemented already. Last year was the first year of its launch. This is a tax credit for working low-income families. So when you file your taxes, you can apply for this credit. And this year, families with 3 children or more can receive up to $1,255. It importantly includes ITIN filers, or people who use the individual tax identification number. This is really important because a lot of people who are undocumented cannot get a social security number, which is typically it is required if you want to apply for federal tax credits like the Earned Income Tax Credit. And so because this includes ITIN filers, we're able to reach many more people in our state. There's also a 3-year window to apply. So if you didn't know about the program this year, or you just kind of forgot to apply, you don't have to worry. You still have 3 years to apply. So for example, if you were eligible last year and you didn't apply for it, you can still apply for it this year. The expansion that we want to make to this program is currently working adults without children who are aged 18 to 24 and over 65 years old do not qualify for the credit. This is a very arbitrary restriction that's based on pretty kind of outdated notions of who is working and who's part of the workforce. We know that there are many people like college students who are 18 to 24 and are working, and also increasingly we see an older working population. So this is one way that we can expand this credit to be more inclusive and make an impact on these populations. And lastly, I want to talk about two different progressive revenue proposals. So one is the real estate transfer tax. This tax would add a 1% surcharge on the sale of properties over $3.025 million. So these are really high value properties, even though property values are increasing across the state. But I think we can agree that if you can pay over $3 million for a property, you're pretty well off. And so this is really targeted to the wealthiest people in our state. It also increases the progressivity of the real estate excise tax, and it can be a regular and reliable funding source for affordable housing, which is a critical need right now. And then lastly, one really exciting proposal that we have is a wealth tax. This is a flat 1% tax on intangible financial assets over $250 million. So intangible financial assets include things like stocks and bonds. They're not tangible financial assets like property. This is really important. This tax would only impact 700 households in the state. It's less than 0.01% of people in the state. So it's really, really targeted to the ultra uber wealthiest people in the state. On the flip side, it's estimated to generate about $3 billion in revenue every year. So you can think about how much this money could really mean to our state and all of the different investments that are needed in our communities. So these are things that we are working on, and yeah, happy to provide more information about just what the policies are and ways to get involved. So thank you. And I'll pass it back to Anya.
Thank you so much, Tracy. That was really helpful in educating us on how our state tax code really has a direct impact on enacting racial inequity, and also for highlighting some policies and mechanisms which are combating this racism. So yeah, thank you for your important work in this area and for sharing with us. I'm going to pass it over to Dr. Anjum, who's once again an associate professor in the Department of Epi, to please share with us about the kind of health impacts.
Great. Can everybody see my slide?
Yes.
Great. Okay. So I'm going to sort of start off talking about the racial wealth gap. Tracy shared a little bit of that data with you. I'm going to share a little more. And then I'll talk a little bit about how wealth impacts health specifically. So what are the mechanisms there? And then lastly, I have some interesting, I think, research that talks about one of the policy solutions that Tracy just mentioned, the baby bonds program. But in terms of health outcomes, how does that potentially improve people's health? So to get us started, let me see if I can advance my slides. There it goes. This is just a little bit of national data around how unequal the distribution of wealth is in the US. It is much more unequal than income, and income, I think, gets a lot of press attention. You know, income inequality used to be such a big thing, but really the unequal distribution we can see very dramatically in wealth. So if you look here at on the left-hand side at this graph, we can see over time, starting in 1983 to 2018, that lower income households tend to have very few assets relative to higher income households. Expressed a different way, this is similar data, but it's expressed slightly differently. What you can see here is that the lowest income folks, the lowest sort of tertile of third of the population, holds about 4% of the total wealth of the nation, whereas the highest third of income holders own about 80%, right? So this is dramatic, really dramatic distributions in inequalities in the distribution of wealth. Similarly, you saw a little bit of data just now on the racial wealth gap. This is similar data to what you just saw, but this is again relative to white households. In the lowest income group, you can see that typical lower income white households have 20.5 times as much wealth as the typical low income Black households. So again, quite dramatic. Similarly, more data on this wealth disparity that we see. The left-hand side is median, the right-hand side is mean. The reason we provide both is just because it's quite skewed. But the big takeaway here is, again, consistently higher levels for white households. So really sort of highlighting the need for some sort of policy intervention to sort of help us sort of bridge this gap. And then this graph is about inheritance. So I did think it was important to consider inheritance because wealth, as we know, has very strong intergenerational component there. And so this is showing that about 30% of white households receive an inheritance, and you can see those numbers fluctuate a little bit over time, but a much smaller percentage of Black and Hispanic households receive inheritances. So another sort of thing to think about. So moving on to think a little bit more about this relationship between wealth and health, I'm just going to show you 3 slides. They look all very similar. So what you're looking at here is overall, as well as broken out by race, just white and Black here. And we've broken wealth into 4 different categories: high wealth, medium wealth, low wealth, and then those with either 0 or negative wealth. So negative wealth obviously is debt. So debt, again, has a huge sort of policy implications there, right? So for something for us to think about for the future. But what you can see here are these very strong gradients. So the health outcome we're looking at here is a pretty simple one we use often in public health. It's self-reported health status. So we ask people a very simple question. How would you rate your health? Is it excellent, very good, good, fair, or poor? And this is the percentage of people that say, my health is poor. And this gradient that you see, meaning the very low wealth holders tend to report much worse health, and the wealthier tend to report much better health, is a pretty consistent story that we've seen time and time again for many health outcomes and for many different indicators of wealth. So we don't only see it with physical health, we see a very similar story for mental health. This is a measure of psychological distress that we use on occasion. Again, very similar story. Those with low wealth tend to report much higher levels of psychological distress than the wealthier. And then lastly, this is some data on smoking. So the reason I selected smoking, we know smoking is a risk factor for many, many, many chronic diseases. And you can see sort of these gradients too with these types of health behaviors that we know are not necessarily good for people. So to talk a little bit about the mechanisms here. So how is it that wealth impacts health? How is it that wealth gets under the skin, if you will? So there are 3 potential explanations that I'll walk through, sort of a high level overview. One is a biological explanation. So this is ideas around the stress pathway. The second is to talk a little bit about education, and lastly, greater future orientation. So this is a really very oversimplified diagram, but what I'm trying to show you here is that chronic stressors and having low assets, having low income, having financial instability, these are all forms of chronic stress. Have been shown, and there's a lot of research to support this, to dysregulate things like your immune system and other systems that are responsible for your stress response. And so we think that there is potentially a very sort of clear biological pathway by which stress gets under the skin. There's also sort of the way that this could work is potentially through unhealthy behaviors. Stress can also cause people to drink more, to smoke more, to eat worse, and that can lead directly to disease. So in addition, another mechanism we think is important is education. So education also helps us by thinking about it as sort of another area for intervention altogether. So we do know that those who are more educated tend to have better access to and better understanding of health information. So this could have an impact on their future health. And the more educated also have different norms and behaviors around health. So that if you look at the data, you will see higher educated folks tend to have lower rates of smoking, tend to exercise more, et cetera. And then lastly is this idea of greater future orientation. So this one is sort of thinking about how savings can allow you to really envision the future that you may not have envisioned before. So there's some evidence to support that savings in childhood is associated with higher rates of college attendance and college completion. But we do have a little bit of uncertainty here with this mechanism. So we're a little unsure if it's savings that causes one to have a future orientation, or if somebody who is just predisposed to having a future orientation causes them to save more. But regardless, we think this is potentially another way in which this could impact your health status. So to finish up here, I'm going to talk a little bit about a couple of studies that have looked at child development accounts. These are also sometimes called child savings accounts, and these are very similar to what Tracy talked about as the baby bonds. I think these are a little bit different in that these CDAs, at least the one I'm going to talk about here, do not allow for other uses besides education. So once you turn 18, you can only use the money for post-secondary education. And the other difference is in some of the CDA, the way they've been sort of developed, it allows for the families to contribute, and that's actually encouraged. So Tracy can tell us in the Q&A if that's a piece of the baby bond policy that we are thinking about here in Washington State, but it does allow for for family members to contribute. So I'm going to share this data with you. This is from Oklahoma. They ran an evaluation of a CDA program. This is actually the largest evaluation we think to date in the nation. And it has shown that people who have these monies in CDA accounts tend to, it has impacted their account holdings, savings, asset accumulation for their children. But I wanted to specifically focus on the health outcomes because I think it's really important to have evidence not only on the economic side, but also on the health side to show that these policies are actually really relevant for health as well. So briefly, they had about 7,000 people that they drew randomly from birth records that they contacted and said, hey, do you want to participate in our study? And only about 2,700 of them agreed to participate. So they took that big, large, close to 3,000 folks, and they broke them into two pretty equal-sized groups. And one group really got a lot of different services. So the Oklahoma State government opened up an account for their children, government-controlled account. It was a 529 account, which is those accounts that are often used to help save for college. And they put $1,000 in all of these accounts. And then they encouraged everyone to also open their own account, and they gave them $100 to start that second account. So two potential 529 accounts. And then on top of that, the government also had a matching program. So if you were low income, you got a one-to-one match. So let's say every month you put in an extra $20, the government would match that $20. If you were higher income, you didn't get a one-to-one match, slightly less, but you still got some sort of a match. And then they provided a fair amount of information about how these 529 programs work and what the benefits are. On the other side, the other group didn't get any of this. They didn't get an account. They didn't get the $1,000. They didn't get even any information on the 529s at all. They were told, these accounts exist. If you want to open one, go ahead. So a couple people did actually opt in, but very few. So what the health outcomes that they looked at, so they followed people for about 4 years, and they looked at two different health outcomes. So one is maternal depression, and the second is socio-emotional development. So what they find is several years later that the people in the asset group had lower depression, the mothers or the birthing people had lower depression amongst this group with assets compared to those who did not have the assets. This was a small but significant effect, and we did see a greater impact on disadvantaged groups. And so by disadvantaged groups, they figured these to be folks at higher levels of poverty, with lower levels of education, and those that received other public benefits. And then on the child side, they do also see better child socio-emotional development amongst this group with the assets at the 4-year follow-up. And this was actually a pretty moderate impact, larger than the depression study. And again, larger magnitudes for those more disadvantaged groups. So at the end, the most recent data we have on this SEED Oklahoma, SEED OK program is from 2019, where the asset group ended up with, has about $3,000 in their accounts, which is about 3.5 times more than the folks that were not given the assets to begin with. So, of course, these CDAs and things do not help alleviate immediate financial concerns, but again, that's not their purpose, but they do potentially have long-term benefits, such as perceived levels of economic security, optimism about the future, and improved self-concept. So I'll stop there, and hopefully we can discuss this more in the Q&A.
Thank you so much, Dr. Anjum. It was really helpful to have you enlighten us on the clear health impacts of the wealth gaps and how they perpetuate health inequity. And it seems like really throughout the entire life course and even intergenerationally. So it was really helpful to see that data and those studies that have really brought us some like information on those impacts. And I was so excited to hear from our panelists that I did fail to ask the attendees to please, throughout the panel, if you have any questions, to please enter them into the Q&A. I see many folks are already doing that. And we will have some time after we hear from each of the panelists for them to answer your questions. So now I'm going to hand it to Chelsea McElroy, the statewide coordinator for Washington for Black Lives, and Samuel Martin, the CEO and founder of SDM Consulting. Thank you.
Thank you so much, Anya. I'm gonna share our slides and dive in.
So hi and welcome. My name is Chelsea McElroy and my picture's on the next slide, but I always want to start any presentation or any type of conversation with Washington for Black Lives and who we are. And our mission is to empower, engage, and unite Black-led organizations in the policies that shape the lives of Black Washingtonians. So a little bit about myself. My name is Chelsea McElroy. I was elected to the Tacoma School Board in 2021. I have been a preschool teacher and a family and child advocate for the past 18 years. And I recently found myself wanting to dive deeper into policy. So I found a role for myself here at Washington for Black Lives as their statewide coordinator and coalition manager. And that's where I met the lovely Sam.
And again, it's a pleasure to share space with you all. My name is Samuel Martin. I served as one of the founding members of Washington for Black Lives and served as a lobbyist from 2021 through 2024's legislative session here in Washington, and have historically kind of worked in the policy space as a lobbyist, as an advocate, even as a youth advocate as well, too, to be able to move forward and progress, various different pieces of legislation and policy priorities, whether that be from child welfare, youth experiencing homelessness, police accountability, kind of the full gamut, climate justice, those kind of things as well too.
Yeah, so a little bit about Washington for Black Lives. This past year, we shifted our approach to supporting and engaging in policy, and we really want to take a tiered level of engagement. Were there policies we want to lead on? Were there policies we were actively supporting? Policies we passively support or actively oppose, and some we were not engaged in. A big policy of ours that we supported this past legislative session was the the no hog tying, which was Senate Bill 6009. And we just kind of saw a direct correlation between the way Black folks are treated in their health outcomes, the same way they're treated in their finances, the same way we're treated institutionally within our schools and broader concepts. On the next slide, we kind of want to talk about what we are doing. And so what Washington for Black Lives is doing, we wanted to engage Black elected leaders and learn more about the policies at every single level and how these smaller policies could then impact the larger conversation and the way that we are taxed. So in Q1, we are reaching out to school board members and we had a really robust conversation with them about the policies that they enact on a daily basis in their small municipalities to change and better the lives of their students. And we're currently in Q2, so we've been doing outreach with city council members and learning about their policies for code revisions and ways that they are over policing Black citizens. And our next quarter will be Q3 with state reps and state senators and some statewide positions and federal positions. And so what type of relationships did we want to focus on that would make the biggest impact? And what we learned through the past 3 years of lobbying and what we're doing now is that many Black folks feel disengaged from the political system, and therefore they don't feel like they have the right to advocate for policies that would change their lives for the better. We hear often from legislators, well, we didn't hear from your community group, so that's why we didn't consider you when we were making these decisions. We didn't have that data, that Tracy provided in front of us, and there was no one championing that, and that's why we didn't make those types of decisions. So as we have been engaged in these robust conversations with policymakers, we're also bringing to them regular people from their community who have similar ideals. And mostly the idea is, what would a fair and equal and just Washington look like?
And, you know, to that point, I think I even saw one of the kind of questions in the chat. It's like, what do we do with the information? What do we do with the research? And, you know, we stay in partnership with, you know, folks like Anjum and folks like Tracy and others to be able to really use and be in partnership with them to be able to take data, research, and information to be able to move forward with tangible policies. Kind of like Tracy alluded to before, some of the like the Working Families Tax Credit, things like that are large collaborative partnerships from community stakeholders across the board, right? And so being able to take what folks are learning in research and being able to kind of work and be actors to be able to help create policy change. And I think that that's one of the places that we aim to kind of fit in. We won't like belabor the data. I think that that has kind of been talked about before, but kind of when we look at the lens of Black Washingtonians and thinking about the disparities that exist, those are very important to be able to uplift and address. And ultimately, when we think about racism and when we think about kind of how to address that, we really do have to also kind of have a lens on what that means for Blackness and like being able to address that, because frankly, the history of America, like America's history with racism kind of really starts with Blackness in particular when we think about, you know, slavery and things like that, as well as the impact to Indigenous communities and Native Americans. And so we really want to be able to kind of look at how that impacts and how we kind of start from there. Again, being able to think about the regressive tax code and knowing that Black Washingtonians make significantly less than the rest of the state. How do we be able to kind of start to address some of these things in policy and in practice change? And so some of those things were already talked about, right? Equitable estate transfer tax, making sure that, you know, we know the disparities that exist with the taxation on large estates in Washington, and knowing that there are also still loopholes for folks to be able to address. And so we want to make sure that we continue to shore those things up and create a space where folks are actually being able to, like, folks are actually paying their fair share when it comes to, like, you know, estate transfers and things like that. Of course, as it was brought up, making sure that we have an equitable income tax, but we also want to recognize that it also goes to, we want to be able to have an income tax, but we also want to make sure that there's an intention around making sure that those resources go to improve communities of color, right? And that not just having those general dollars kind of just go across the board. We want to make sure that we're addressing some of those institutional discrepancies for the communities that are the most impacted when it comes to being able to have like economic mobility. And property taxes as well. You know, we want to make sure that folks are paying their fair share, but for the folks who are looking to be able to generate income and accumulate wealth, shouldn't be overtaxed as well either, right? When we think about some of the local property taxes that exist in different places, and sometimes how folks are overly taxed as they're trying to be able to generate wealth and as they're trying to kind of grow and, you know, being able to gain assets. And so we want to make sure that communities of color and Black folks are not overtaxed when they try to generate wealth as well too. And again, opportunities to be able to have tax credits, opportunities for economic mobility, working families tax credit, GBI, baby bonds, direct cash transfers, all of those things are very important to us. And as we mentioned, right, making sure that we're really working in partnership with our folks, you know, at the Budget and Policy Center, at the UW and others to be able to make sure that we're really working together to be able to get these things through and implemented in a way that's intentional. And another thing that we think is very important is also reparations for the descendants of slavery, right? And that we should continue to uplift and highlight that conversation as well too, and that we can't continue to lose that in our conversations.
I think that really leans into some of the work that we were doing with partnering with the elected leaders like Representative Jamila Taylor. She really worked really hard to pass a bill that ended up giving opportunities for folks to get grants to get down payment assistance. And the African American Leadership Forum got $100,000 down payment assistance programs for 20 African descendants of slaves who live here in Washington State. So there are 20 families now that had $100,000 just to go into that down payment assistance of buying homes in their home communities. I know Sam, like myself, we're third and fourth generation Washingtonians, which means our grandparents and our parents were victims of redlining. And if you look that up, you already know what it is. So I don't got to go into a lot of details here, but because I know this is a safe space. And so we've all done our research, but if you haven't, there's a really good book. It's called The Color of the Law. And it explains how across the nation, but then you can look into it deeper in your own local municipalities. You can find those red line maps to see what part of the neighborhood do I live in. And so when we talk about moving this work forward, it does start with reparations. And there are small ways that we can get reparations through policy change, like the baby bonds, like the down payment assistance program and things like that.
And
Uh,
thank you.
yeah,
And
go ahead,
continue
Sam.
up with the intersection of our work, right? And knowing that to improve this for all Washingtonians and for Black and Brown Washingtonians, it's not just addressing the tax structure, it's recognizing that these communities are overtaxed and underpaid, and we have to address institutional racism at large, right? Like you can't just make a bunch of bills that will address the tax code specifically and assume that that will address racism and the discrepancies that we see when it comes to income. And so understanding that these are important steps, but also that we have to continue to be addressing some of these systemic inequities that exist for all Washingtonians to benefit, but also for Black Washingtonians as well too, when we look at the disparities that we see. And so this also requires community engagement, right? Like we should be working with community. We should be bringing folks to the table to be able to figure out what actually works best for them. What actually do they need? How do we make sure that we address things like, having access to healthy food, having access to the things that provide, that ultimately will improve health outcomes, things that will ultimately improve professional workplace outcomes, academic outcomes, all of those things as well. And recognizing that these things are all interconnected and that you can't address one without addressing the other, and that you have to always be kind of looking at the lens of racism when you're approaching this work and, trying to do that intentionally.
I think one thing I'd add to that, just to have a little bit of fun, but it's actually not a lot of fun, to think of the history of money. What is money and what is currency and what was currency? Black bodies were the currency that created the wealth for this nation. So we can't move forward in speaking about the tax code and speaking about money and thinking about institutional and systemic change without recognizing what currency is and what it was. So just a Black body was worth X amount of wealth that generated generations of wealth across this nation. And on the next slide, it will tell you how to keep in touch with me. To learn more about Washington for Black Lives, please reach out to me directly, Chelsea@wacommunityalliance.org, or go directly to our website, WashingtonForBlackLives.org. It's been our pleasure to share with you, and I'll hand it back.
Thank you so much, especially for the really critical work you're doing to address structural racism, historical and present, and really the impact on Black Washingtonians, and doing so through really community-informed advocacy and policy. So thank you so much for sharing. It was great to hear from you both. Next, I will pass it to Lily Dearwater, the Economic Inequity and Health Program Manager for Washington Physicians for Social Responsibility.
Awesome. Thank you. Let me just try to get my screen set up here. Can you all see that?
Yes.
Awesome. Great. Well, thank you for having me here, and thank you to the amazing presenters we've heard from so far. You're all awesome, and it's really cool to be here with you. My name is Lily Dearwater. I use she, her pronouns, and I work with Washington Physicians for Social Responsibility as the Economic Inequity and Health Program Manager. Like Tracy, I'm a graduate of UW's Community-Oriented Public Health Practice Program. And I'm here because tax justice is an integral part of WPSR's work, but on a personal level, because I find the role the tax code plays in our lives to be deeply fascinating. No one really wants to think about taxes. They have this reputation of being necessary, but boring and confusing and inconvenient. Yet taxes have so much power when it comes to racial justice and health disparities. They can be a tool of oppression or justice depending on how they're set up. And without taxes, we wouldn't be able to fund the social safety net services that we all need. And I will say, as Sam and Chelsea pointed out, that doesn't mean taxes are a golden ticket. They aren't going to solve every problem we have, but they do have a lot of power. So taking a step back, I want to share a little bit about WPSR. WPSR is a health professional-led advocacy organization. We leverage the voice of health professionals and those passionate about our work to educate the public, influence decision makers, and promote policies that support our mission of engaging community to create a healthy, peaceful, just, and sustainable world. Despite the physicians in our title, WPSR is made up of folks from all sorts of health-related disciplines, including public health practitioners, like probably some of you here. Although we're, despite being this organization of health professionals, we actually rarely focus on healthcare. Instead, we primarily focus on upstream determinants of health. WPSR has 3 programs, all of which have a task force of volunteers: nuclear weapons abolition, climate and health, and economic inequity in health. I co-chair the Economic Inequity in Health Task Force, where we focus on economic and racial justice. I lead this task force alongside Charles Mayer, who's a family doc and a volunteer with WPSR. Our priority policy areas are progressive taxation and housing, and our work is aimed towards a future where all Washingtonians have enough money, are housed, and structural racism no longer creates health inequities. I'm here today to talk about actions we can take to transform our tax code. But before I get into that, I wanted to highlight Professor Dorothy A. Brown. She's a tax law professor and the author of the book, The Whiteness of Wealth: How the Tax System Impoverishes Black Americans. Her work uncovered a lot of different ways that the US tax system perpetuates structural racism, and she's inspired a lot of other great research. And the idea to plan today's event came from a discussion of her work. And I want to share this quote from her, which is, "Every April 15th, the tax code, which disadvantages Black taxpayers while advantaging white taxpayers, increases the racial wealth gap." So if we could solve the racial wealth gap tomorrow, but it would start up again next April 15th. And this is especially true in Washington state, where we've long been aware of the racism in our particularly regressive tax code. So how do we make our tax code more just at the state level? Tracy went over these already, and so did Sam and Chelsea for some of them, but I wanted to do just like a 1-sentence refresher on each of these policies. So the Working Families Tax Credit went into effect last year and gives cash back to low and middle income working Washingtonians. We're advocating to expand the tax credit to all qualified adults 18 plus. The capital gains tax is a tax on profits over $250,000 from the sale of assets such as stocks and bonds. Fewer than 4,000 of the wealthiest Washingtonians paid this tax in its first year, and it provides nearly $1 billion in education funding a year. Unfortunately, a repeal is on the ballot in November, and that would undo significant progress we've made in making our tax code more equitable. The wealth tax would tax intangible assets in excess of $250 million. It'd be paid by only the wealthiest of the wealthy, fewer than the capital gains tax. The Affordable Homes Act, which is another name for the real estate transfer tax, would fund affordable housing through a progressive change to a real estate excise tax. Guaranteed basic income is a monthly cash payment for those with income under a certain threshold and who fit other criteria. And finally, the one we've heard the most about, the Washington Future Funds, a baby bonds program where infants on Apple Health would get money invested for them to use as adults for wealth building purposes. And so at WPSR, we select our priority policies in collaboration with coalitions and partners, because you can't do this work alone, and it's important that we work with the communities who are actually affected by these policies. And I just wanted to shout out some of our partners who are, besides those here tonight, which include the Balance Our Tax Code Coalition, Washington Low Income Housing Alliance, the Economic Opportunity Institute, and many more. So how do we pass these policies? There are many ways to take action and get involved with Washington State's legislative process, which I'll go into in a moment, but a lot of work happens beyond that process. No one can pass policy alone, and a big part of policy work is building communities, changing social narratives, and continuously learning as we go. These are all pretty abstract, so I'm going to provide some concrete ways to advocate for policy change, especially because it's often pretty opaque, which, as Chelsea and Sam mentioned, often keeps communities from engaging in this work. And this list won't cover everything, but it's definitely a place to start. So, contacting your legislators. It can seem really intimidating, but they genuinely want to hear from you. We're always looking for people to reach out to their legislators because the legislators are much more likely to listen to people within their own district. You can email them, call them, or even better, set up a quick 15-minute meeting with them. Many organizations, including ours, also send out emails advocating for policy. And once you sign on, those automatically go to your legislators. You can also go to a town hall where you can ask a question about an issue that matters to you. And during the legislative session in the winter and early spring, there are opportunities to participate in lobby days in Olympia. Many different organizations host lobby days, and we can always connect you. And then the first link on the slide, which I'm going to try to drop links in the chat while I'm talking, so bear with me. All right. I think that was successful. Anyway, the first link is for the Find My District tool. And so if you enter your address, you can learn your district number and who your legislators are, and you can click through to find contact information for them, and you can send them a message about an issue or set up a meeting that way. And then the second link is for a roster where you can email or phone your legislators directly. And I would very much recommend including the assistants that are listed there, because the legislative staff is incredibly knowledgeable and they're often quicker to respond. You can also engage in hearings. There's several ways to make your voice heard during the legislative process. So before bills pass, they they go through several committees. In committee, there's an opportunity for the public to give input during hearings. You can give verbal testimony, which usually involves speaking for or against a bill for 60 seconds, although sometimes it's a different time length. When our volunteers testify, we work closely with partners on our messaging, and we practice timing because there's a hard cutoff after that time limit. You can also submit written testimony on a bill or sign in pro or con, which simply means stating your position on a bill. Sign-ins are one of the easiest ways to get started, and they really make a difference. Legislators take into consideration the number of pro and con votes. And so to engage in this process, you can follow bills online if you know the bill numbers, but that's often hard to find out. And alternatively, you can follow, whoops, that didn't copy, advocacy organizations such as ours or the others speaking tonight, and they'll send you emails that they'll track the bills, they'll send you emails, they'll let you know when it's time to act. Another way to engage is with media. Social media is a great way to share actions and information, and you can even tag legislators. There's all sorts of things you can do with social media. And then submitting op-eds and letters to the editor is also a great way to make your voice heard. Even if a newspaper's audience is limited, your legislators and their staff are definitely keeping an eye out for published pieces on their policies. And finally, I just want to emphasize the importance of talking with other people. A simple conversation is way more likely to persuade someone than any mass communication possibly could. And this goes both ways. Like, you should listen to the other people around you and in your communities and find out what policies are important to them and what policies to use these advocacy methods for. And there's also opportunities to attend events like this one, put on your own event, share actions, and more. And so that was a lot of information very quickly. So feel free to reach out with any questions. If you want to get more involved, I'll drop some links to sign up for action alerts and learn more. I also encourage you to follow and sign up for emails from the other organizations that presented tonight, Washington for Black Lives and Washington Budget and Policy Center. Thank you very much. I'll pass it back to you, Anya.
Thank you so much, Lily, for sharing about WPSR and their policy priorities, and furthermore, for ensuring that community members are really informing those priorities. So it's really helpful to know about opportunities that we can use our own power to advocate for impacted communities and fight structural racism. And thank you for dropping those links as well. Okay, so now we got a lot of really great questions in the Q&A. So we can try to answer as many as possible, but maybe I'll just narrate one to start us off with, and any of the panelists can jump in. So one of the attendees noted that this is a nationwide problem. If we combine federal, state, and local income taxes, the lowest rate is paid by the richest 400 families in the country. They're all white. While we need to make Washington's taxes more progressive, what might you suggest be done nationally?
Should we just jump in?
Please.
Okay, well, I can start off with this, but I'm sure there's many different answers to this. I would just suggest a national wealth tax. There are proposals for that. The reason why is because like the richest people in our country and in our state are like they're not becoming rich through income as much as wealth, as Anjan was saying earlier. So I feel like people have heard news of like Jeff Bezos doesn't pay any taxes because his income is very low, but he has billions. Like, I mean, he's literally the richest man in the world. And so the way that people are accumulating wealth is very different now, and our tax code has not caught up to that. And so we need a wealth tax on intangible financial assets at both state and federal level.
I'd also just add, I think the benefit of being able to make progress on the state level is that it motivates and incentivizes other states to make progress as well too, and allows us to be national leaders. And, as states continue to be able to continue to pass and progress, various different progressive taxation legislation, that will ultimately help to motivate things on the federal level as well too. I think when you have 15, 20, 25 states that are moving forward on things like that, you see the traction for things on a federal level really move forward.
Thanks so much. Give space if any other panelists want to answer. If not, I can go to the next question. I think this next question might be directed to Dr. Anjum.
It says
we
she's
have-
typing an answer. The second question,
Which one?
from Doris, it says Tracy Young
Oh.
is typing an answer.
Oh, regarding net worth. Is that tied mostly to home ownership? Do you want to answer that live, Tracy, or?
Oh, sure. Yeah, I was typing an answer. Net worth definitely is tied to home ownership, but just kind of what I was saying earlier, it's increasingly tied to intangible assets like stocks and bonds.
I can also add to that, like if you own some assets, but not very many assets, a lot of your assets are likely to be your home. But then once you get wealthier and wealthier and wealthier, then it's more and more intangible assets. I mean, you can have more homes too, but there's a limit to that. Whereas intangible assets feels almost limitless.
Thanks so much. There's also a comment about the Oklahoma study, which I believe Dr. Anjum referenced, and a curiosity of why only 37% of those invited to participate chose to do so. I didn't know if you wanted to comment on that.
Sure. Yeah, so I think what the researchers are saying is a couple different things were sort of seen as barriers. So one is a social security number is required to set up these 529s, and people don't like to give out their social security for obvious reasons. So that was a sort of a hesitation, I think, for many families. Secondly, remember this was 2007, 2008. This is well before we started having conversations about reparations and all of these things. So some people simply just didn't believe that the government was going to give them $1,000 and put it in an account for their child. They were like, this is some sort of scam. I am not doing this, right? But if you look at their overall response rate, it was about 40%. I mean, and as we know, for those of us who do research, 40% is a pretty great response rate. So, it's sort of along, and it was a research study. They still had to fill out, all the questionnaires and talk to the researchers and do all the things. So but yeah, I think that was potentially the reasons.
Thank you. We have another attendee who said they're currently working on a report regarding housing affordability in Seattle, which we know disproportionately impacts and displaces communities of color. They ask how we might reconsider taxes in ways that allow lower income families to own and stay in their own homes and neighborhoods.
Well, I think we need a rent cap, like full stop. There needs to be a rent cap. I'm a renter. I testified on behalf of Tacoma for All down here in Tacoma. Like at the end of the day, it's unsustainable to rent. It's unsustainable to buy because there are no caps on these things. Hedge funds and banks own more homes than people. So, I mean, when you just kind of consider like all those facts, I'm not really sure if I can answer the question, but I know that there's some things that we need in order to keep people in their homes. And so I just feel that all to say that taxes are not going to be the end all be all to keeping people in their homes, but there's some other policies at the local level that need to be passed. So like at your city council, you can ask for rent caps or ask for tenants' rights and protections. And like at your legislator, you can ask for additional protections for tenants and homeowners and things like that.
Yeah, plus one to what Chelsea said. I would also add, like, our state allows there's a property tax exemption for seniors, low income seniors right now. But it's age restricted, right? So one possibility is to have just a non-age restricted low income property tax exemption. That's not something that I think a lot of lawmakers are talking about, but increasingly as home ownership is so just unsustainable, I think that is something that will come up in conversation more and more.
Would any other panelists like to comment?
I just want to add to sort of what Chelsea was saying about housing policy. There's a rent stabilization bill that's got a lot of momentum at the state level this past year, and use all those methods I shared to advocate for it in the coming session. This is my opinion, not others, but yeah.
Thank you. Okay, another question. What strategies can we use to communicate the benefits of tax reform, given the prevalent worry that progressive policies increase the cost of living? And progressive is in quotes.
We have to lead our own narratives. I think that progressive folks, low income folks, people of color, sometimes, and honestly, Democrats always lose their narrative. They let other people start redefining and defining that story for them. So if the policy is good policy, it helps a majority of people. The majority of progressive policies help more people than they hurt. And I think that often when we let go of that narrative and let someone else start spinning it for us, we're not able to effectively change the outcome because we're not effectively communicating the need. We're not effectively communicating also the mass good. It just sounds good, right? So like when conservatives hear these bills, if you look at West Virginia, it's a majority conservative state and they voted in favor of conservative policies. And in the end, it harmed the majority of people because they didn't want to latch on to anything that seemed progressive. But now in West Virginia, they're literally training former miners to do solar panel work and to learn how to work on windmills, which 10 years ago, 20 years ago, they're saying that's progressive. You're trying to brainwash and all the things that they'll say. And so it's like when we lose the plot, we lose the story. We can't adjust the conversation to come back to what is the purpose of this policy? And the purpose of progressive policies is to help the most amount of people.
That, Chelsea. And I think this is really similar, but adding on to that, just like in our communications, we always say like lead with the values, values that we can share, like other people understand, such as like just being able to like meet your basic needs, right? Like having a life of like dignity, freedom, and joy. And this is the world that we want to build for one another. And then just really tangibly talking about what the taxes will bring. For example, Lily was talking about the capital gains tax, which the revenue is earmarked largely for early learning. So we talk about how many additional like little kids, right, can have really quality early learning education programs. And like then it's not just about like, oh, it's this 7% tax on capital gains profits over $250,000. It's like these like kids in your neighborhood, like kids in your community, people that you work with, right, who are struggling to find affordable quality childcare, and people can really relate to that.
And building off of that and what Chelsea was saying about like controlling the narrative a little bit. When we're talking about the details of tax policy in a very tax way tonight, because we're talking about how taxes act as a system. But when we're talking about why these policies should pass, it needs to be what they fund and what brings us together about these policies, like the education, the housing, all of these things. That's how you persuade people with taxes, not telling you that it's a 7% tax.
Thank you all. There's another question and kind of a comment that, there does seem to be a lot of research that is showing the structural racism that's in the tax code and in the race and wealth gaps. And I think sometimes it is frustrating, especially like as part of an underrepresented minority, to have this research and not really see anything being done about it. And I think each of the presentations we heard from today really shared some like tangible and actionable ways that we can advocate for others and ourselves. So I know we shared those in the presentations, but maybe it would be helpful to kind of recap top takeaways of really how we can work together to change this and really fight back the structural racism.
Well, I think one of the things that I can say obviously is, all the various different organizations and folks involved here today are, looking to be able to work and do this change work. And some of the organizations represented are in the chat as well too, right? And so I think being able to find and connect with some of those organizations are going to be critical to be able to like have tangible ways to do this work. This doesn't totally answer the question, but I do think that one of the things that really is important to being able to like even just start this work is coming to terms with the history of everything, right? Like you have to acknowledge that, historical racism exists. You have to acknowledge those things and like come to terms with those things as a reality before you can even kind of come through and do this work, because it's hard work. Equity work in general is hard work. And all of us have equity work that we have to continue to be doing. But the second step that I think that is really important, and I think Anjum kind of alluded to it in regards to the question on Oklahoma, is you have to build trust in communities. You have to build trust, and you have to ensure that we're working to make sure that folks want to come to the table in the first place, right? And want to come and support this work, because myself, even as a lobbyist, right? Like the thing that is the most effective in policy change is not actually me as a lobbyist, right? It's the community members. It's being able to connect with folks who actually go and talk to their legislator and feel motivated and energized and excited to be able to do that work, and to be able to like move forward those policies. And so we have to energize and motivate our community members to be able to want to do this and engage in this work. But that starts with healing and creating a place that feels safe, which historically has not been the reality for communities of color and Black and brown folks. And so you have to do your coming to terms with the reality work, and you have to build do true healing work and create spaces for folks and share power. Like sharing power is critical, right? Like it's hard to let go of the power that a lot of us actually hold in these spaces, but it's going to be necessary to actually like create true change.
So yes to everything Sam just said, for sure. And I also wanted to add that political process is often slow, and so it can seem really frustrating because you want to see, like, we know what is just, we know this should change. We want it to change now. And it's just a slow process, but you do see the progress. Like, I've only been doing this work for a few years, and each year the bills we prioritize make it a little bit further if they don't pass, and more people sign in pro for them. Like you see incremental progress, whether or not you're seeing the big progress, and it does move forward, but it is a frustrating pace sometimes, which is why everything Sam just said is super important, and it's important to take care of yourself while you're doing this work.
Thank you. I think that's really also a core value of our Department of Global Health is really centering community voices and allowing that to inform priorities. And I think we all working in public health and global health, we know how difficult and time consuming it is to really have research translate into policy. And I know that is a goal that many of us share and would like to see. So thank you so much for commenting on that. We received another question that's kind of related in terms of how we organize powerfully across the state with people and control the narrative, and whether this is really building towards a movement to address structural racism in the tax code.
So join a coalition, join a group. There are so many micro coalitions around the state. I think during COVID, I joined like a retirement coalition, and it was like to help elderly people like learn how to access like Apple Health and things like that. So I feel like there's a lot of coalitions happening at the same time. Go into Facebook, and I know it's toxic. Go there, type in some of the things you're interested in. There are groups, and from those groups, you can find good people. You can contact their admin and say, what are you guys doing and when will you do it? You can also like look into the groups like who are presenting today, and then find out about their lobby days, join in with people like that. When you're down there lobbying, that's when you can meet those legislators, but you can also meet other groups while you're sitting in the hallway waiting for that legislator who's definitely blowing you off. You'll meet other people who want to meet with them for something else, and you'll find more ways to agitate and push towards a more fruitful conversation. Also, by understanding what's happening at your local level. When you get your cities and your smaller municipalities to buy into something, it is so much easier to take things down to Olympia. And so like when I hear state advocacy, I think of lobbying down in Olympia and advocating for change at a state level. But when you start in your local municipalities, find out who's doing it in the city next door to you. So if I'm in Tukwila, I want to know what's happening in SeaTac. If I'm in Renton, I want to know what's happening in Kent. You know, so that way you can find out where it's taking traction. Find cities that are already doing the things that you're interested in, so that you can kind of mirror that. And when you talk to your legislators and your policymakers, you can say, this is what they're doing right next door. What are we going to do about it? And then if you come to them by yourself and they don't want to hear you, come back with 5 people. If they don't want to hear 5 people, come back with a banner and 25 people. If they don't want to hear 25 people, call the news. Like you have to like really organize to make politicians aware that the people want to see change. And if you don't do it in that way, no change will ever happen. So I might not have answered the question, but join groups. And I don't know how we from here can make this concerted effort, but I know like at Washington for Black Lives, we have 17 member organizations who all believe in this work. And without their 17 member organizations, I wouldn't have a job and I wouldn't be here with you today. So those 17 organizations are trying to move this work forward.
I'd also add one other piece just quickly around creating levels of engagement for people, right? Like some people can go down to Olympia and do the testifying and organize and be at the lobby days, but some people can only share a meme or like share a Instagram post, you know? And so like being able to like kind of have the breadth of engagement to be able to still get information out in a way that is accessible and youthful as well too, right? Because I think being able to like engage young people using TikTok and all those things are actually going to be able to kind of like generate and get a larger population of people who are motivated and energized. And we always really need to be skewing towards engaging younger generations so that they can those are the folks who are really going to move the work forward and continue to kind of like carry the weight and carry the torch, right? And so like how do you make this accessible for somebody who's ready to drive down to Olympia once a week and for somebody who really is only going to see your stuff on Instagram, you know?
All right, I'll jump in really quick too. In regards to the first question, like, is this really building a movement? I really feel that like this movement is growing. The coalitions that I'm part of, whether it's for like progressive revenue or GBI or baby bonds, we're having like new partners, new organizations come and join our coalition meetings all the time. And it spans so many different like areas, like like all the education, right? Early learning, K-12, higher ed. It's like food and nutrition security groups, like housing advocates. We have like advocates for racial justice and immigrant justice. And of course, like health advocates. And so people are really seeing the interconnectedness of this work. And it's really exciting. And so I also want to extend an invitation if you want to join this movement, right? Please like contact us, follow all of our organizations, and yeah, help us to build this movement.
Thank you so much, all the panelists, for answering that. We are close to time, so maybe I can pose one final question from our Q&A, which is if Washington implemented all the tax reforms you suggested, what are some public health policies that you would like to see implemented, dreaming big? And maybe while answering that, others can enter, other panelists can enter their contact info and any links to their organizations in the chat so that attendees can have those. Please go ahead, Chelsea.
I was gonna say canopy coverage. If they were to like handle the tax issue, I really wish that there would be more trees in urban areas and that more children would get to experience the beauty of Washington that some of us grew up with.
I agree. So much we can do on the health policy side, and I am fully in support of more green space. I think that's a really critical one. I mean, we have a lot of environmental justice communities around the state that really need help cleaning up the environment and money too. So those are all, in my view, public health policies. But definitely.
I also want to say, I think tax transformation is public health policy. I certainly found my interest in taxation during my public health degree. And so I want to include that. But that being said, there's all sorts of public policies related to public health. Like Sam and Chelsea were saying, like, taxation doesn't solve racism. There's so many policies we could implement that would also address structural racism, and, you know, climate change is a big problem. There's policies that would address that. These housing issues we've been talking about, all of these, there's a lot of policy stuff going on, but a lot of them need funding, and wouldn't it be great if we funded them in a just way?
Well, I feel like I named what I want to see, which is like a statewide guaranteed basic income. Everyone has an income floor, is able to meet their basic needs. And one I didn't mention is like universal health care. Right? It's very health related. That's sorely needed in our country.
I'll go in the human services space. I come from like the child welfare and like the foster care space kind of primarily. And I think on top of all the things that are said, like how can we continue to support families, right? Like how are the ways that we can support families so that they can stay together, stick together? And again, I think it's in the same alignment of like GBI and things like that as well too. But like I think ultimately that will help to be able to like preserve families, particularly Black and Brown families, and making sure that, you know, when you have a family together, then you can generate wealth and then you can have wealth that be passed on, those kind of things. And so I think if we look at, you know, being able to support families and supporting them in a way that is authentic and real, I think that's a big piece of it.
And I'll just add one more real quick, is labor policy, right? This affects all the workers, right? The workers who need it most. Like Washington State is one of the few places that has a domestic worker rights, Bill of Rights. You know, and we are doing a lot in the space of working with our gig workers and all of these folks, but we could still be doing more. So labor policy is also public health policy.
Basically, if we fix the tax code, we can fix everything else. That's what I heard.
Okay, thank you so much, everyone, and especially to our panelists for being here with us and taking your time to educate us and inform us and really to help mobilize us. It's been a really helpful event, and I also want to thank the attendees for also taking time to be here and learn more about this. Because I think what a common theme was that this is something we all really need to work together on, from our own roles, our work, what power we do have. So I think this was a really, really helpful and amazing event. And just a final thank you to our panelists. And we will try to circulate contact info also after the event and links to the organization so that you can read more about it and how to get involved. So thank you very much, everyone.
Thanks.
Thank you so much for joining us.
Thank you all.